Module 2, Michaelis Menten Kinetics. This module is all about describing what affects the rate at which reactions are operating at. So what are some important pieces to keep in mind here when we're thinking about how things are absorbed in the gastrointestinal tract, how enzymes are catalyzing reactions and controlling the speed of reactions, for example, metabolic reactions. So let's look at some important pieces of the puzzle here. The first thing we want to think about is substrate concentration. That is the substance that you're either trying to move or convert into something else. If you have more of that substance around, or substrate, then you're going to increase the rate of the reaction. You simply have more to work with. So the more substrate you have, the reaction rate can theoretically increase. However, we can also saturate a given transport mechanism or an enzyme system. So that's important here to understand, saturation kinetics. So there are some terms here that we need to familiarize ourselves with, and then I'll show you some graphs to explain this a little bit more. So the first term that we need to familiarize ourselves with is Vmax, or the maximal rate of a reaction. So each enzymatic reaction that we have, or chemical reaction in the human body, or each transport mechanism, so for example, the ability to absorb something across the gastrointestinal tract cells, has a maximal rate at which you can perform that particular reaction at. And that's what we call Vmax. The second term here is something called Km, or Michaelis constant. This is the substrate concentration that corresponds to half of Vmax. So it's half the maximal rate. So Km is just a concentration value of that particular substrate at which you'll achieve half of the maximal velocity that you could perform a given chemical reaction to run at. So, how do we translate this into something useful? Well, at values of low Km, we have higher affinity for a particular substrate, which means that I'll have more rapid uptake. So, for example, if I have a transport protein for glucose that has very low Km, there are some transport proteins, the GLUT proteins, that transport glucose throughout the human body. Well, there's one of these GLUT proteins for the brain that has a very, very low Km. And so we can very, very quickly saturate this reaction with a low amount of glucose. Why? Because the brain is trying to keep a steady stream of glucose going to the brain. So a low Km ensures that you're going to get your fair share of whatever substrate you're trying to get. Whereas a higher Km, we have a lower affinity for that particular substrate. So there's less attraction there for that particular substance, which means that you get a slower uptake. And to really get a lot of that substrate moved or participate in an enzymatic reaction, that means that you have to have a much higher concentration of that substrate in order to get more of the stuff through the reaction that you're trying to perform or to transport it to wherever it needs to go. So just to summarize, a low Km, you have a higher affinity for whatever substrate. It means you're going to get a much more rapid uptake. So you can saturate that enzyme system or that transport protein much more quickly. A higher Km gives you a lower affinity for a particular substrate, which means that you're going to have a much slower uptake. So the enzymatic reaction or the transport protein is going to really need a lot more of the original substrate to perform that particular reaction at a higher rate. So let's take a look at this graphically. So on the y-axis here, we have the reaction rate as a percentage of Vmax. And on the x-axis, we have the substrate concentration. This dashed line represents Vmax, so this is the maximum rate that a reaction can run at. And here's a typical saturation curve. Now, if we say that the Km for this particular curve occurs down here at this small dashed line on the x-axis, we're saying that we have saturated the enzyme or the transport protein to half of Vmax here. So in this particular curve, this would be one that is exemplary of a low Km or lower Km value. So you can see that the curve increases very, very rapidly towards Vmax. And so what you're trying to say here is that that particular substance is going to be easily transported or easily catalyzed by enzymes for whatever reaction you're talking about. So let's compare some different Km curves. Again, here on the y-axis we have reaction rate as a percentage of Vmax. Here on the x-axis we have glucose concentration. So we're going to use glucose as an example here. And we're going to use those transport proteins that we were talking about earlier. So there are several of these, as I mentioned, and each one of these curves, the green, the red, and the white, represent a different Km value. So the green curve, we got 1.6 millimoles per liter, Km of 5 millimoles per liter for the red line, and a 20 Km value for the white line. So remember that the lower the Km value, the greater the affinity. So we would expect with lower Km values that we would saturate that transport protein much more quickly compared with the 20 Km value here. And that's exactly what you're seeing. So at Km values, you can see that the lower Km curve here, we saturate that particular transport protein much more quickly compared with the red and the white line Km values. So that affects the rate at which reactions can be undertaken. And in this case, this is affecting the transport of glucose into whatever tissue that we happen to be talking about. The next thing that is going to be of concern for us is enzyme and carrier concentration. So the reaction rate is limited by the number of enzymes you have around. The reaction rate is going to be limited by the number of transport proteins that we have hanging around. So theoretically, the more that you have enzymes, the more transport proteins or carriers, then the faster the reaction will be. Temperature also affects reaction rates. So within reason, we can increase body temperature and actually improve reaction rates. Most reactions in the human body respond very, very nicely and work optimally at body temperature, 37 degrees Celsius. So that's why we try to keep that homeostatic level around 37 degrees Celsius. At levels of 50 degrees Celsius, as you see in your slide here, we can actually get protein denaturation. So it'll actually destroy proteins, and then obviously that is going to reduce the ability of the body to perform these reactions accordingly. pH also affects the rate at which reactions operate at. Again, the homeostatic level here, we like blood pH to be around 7.4. And so if we start tinkering with that, we can manipulate the reaction rate as well. The last thing here is ionic strength. So ions are positively or negatively charged particles, and this is going to affect the rate at which a reactant can run at. So when we look at all of the ions in a particular given fluid in the human body or in a particular compartment of the human body, that can affect the rate at which we run a reaction at.